We don't have to be here all night long. So you are at the shoulder pain workshop, just in case anyone wasn't clear on this, today's shoulder, not back. And my name is Mari, as I told you. My full name is Mariko Edwards. And just to tell you a little bit about myself, I graduated from Mount St. Mary's College in the year 2000 with a master's degree in physical therapy. I became certified in Pilates in 2005, and I often use a lot of Pilates exercises and techniques in my treatments programs with my patients. I became a board certified specialist in orthopedics in 2010, and over my past 20 years of working in the clinic, I've treated countless numbers of patients with shoulder pain. So I've seen a shoulder or two in my day. I can't believe it's been 20 years. So tonight we're talking about the shoulder. What structures are we talking about when we're talking about the shoulder? Well, there's the joint itself, and then there's the muscles and tissues which attach to the joint. The joint is made up of 3 bones, and I'll take you to a slide here. The first is the scapula or shoulder blade. Then you have the clavicle or collarbone. And you have the humerus, which is the uppermost long bone in your arm. So those
I don't think it's that funny.
Make up your shoulder joint. Okay, so those are the bones, and now we're going to talk a little bit about the muscles. These include the rotator cuff, which is a group of 4 muscles that help control the movement of your arm and help to stabilize the joint. So what could be some possible sources of your shoulder pain? I mean, there's many, but just to name a few, it could be the muscles themselves, it could be the bursa, it could be nerves, or it could even be the capsule. So let's first talk about the muscles, and more specifically, the rotator cuff. So the picture below is going to show you a front and a back view of the rotator cuff muscles. And as you can see here, the rotator cuff muscles originate on the scapula, and then they insert or attach onto the humerus right here. And as you can see,
when they say your rotator cuff tears, where does the tear occur?
So I'm going to show you that right now. So as you can see, the tendons and the muscles have to pass through this little space here and here. And when that space narrows, that can cause problems. That's how you start to get fraying, you get tendonitis, or you can get tears. And we'll talk about that a little bit more in detail coming up. So those are the rotator cuff muscles. The bursa. A bursa is a fluid-filled sac that allows for muscle and tendon to glide more smoothly over bone and ligament. There are 8 bursa in the shoulder joint. The bursa that is the most common culprit for pain, whoops, went too little far, and is also the largest, is the subacromial bursa, and that's this one right here in the purple. And as you can see, it is also located in that small space, which can get pinched when that space should narrow. So that's where you start getting your problems. Okay, nerves. So some people experience pain that they describe as radiating down their arm, or it feels like tingling or electricity. This type of pain is characteristic of nerve pain. The nerves that exit the neck pass through the shoulder area and can get pinched by bones or tissues, which results in those types of symptoms. So that's going to give you, again, that tingling feeling or that electrical type feeling. That's all nerve type pain. And finally, the capsule. The capsule is a fibrous sheath that completely surrounds the shoulder joint. So whereas the structure of the joint creates mobility, the capsule aids in stability. It helps to stabilize the ball within the socket. The structure can be a problem if it becomes too stiff, as is the case with frozen shoulder, and we'll talk about that in more detail coming up as well. Whoop. So, what type of daily activities bring on your shoulder pain? Do you have pain with reaching overhead, getting dressed, reaching behind your back, lifting or carrying? If you can reproduce your pain, that means that you can reduce your pain. What is it about that movement that triggers the pain? If we correct the movement, correct the alignment, the stiffness or the weakness involved with that movement, we can reduce the pain. And really, I mean, that is our goal. We want to reduce and hopefully eliminate our pain. So I have a quote here that says, "In the face of pain, there are no heroes." In other words, we don't get any reward for living our life with pain. But if that's true, then why do so many of us put up with the pain that we have? Why are we all walking around suffering like we do? Well, we found there's basically 3 ways that people deal with pain. The first is they ignore it. And unfortunately, this is the #1 way that people deal with pain. You feel that pain every time you reach up into a cabinet, but you just keep telling yourself, well, if I give it time, if I take some Advil, it's going to go away. But then unfortunately, it never really does. So we kind of just push it away and ignore it. The second way that people deal with pain is that they alter it. And that means you take a medication or you get maybe an injection or shot, but that is only masking the pain. That's not really managing the cause of the pain. So the third way is actually the most important way to deal with pain, and that is to handle it. You want to address your pain head on, seek out treatment, and figure out what is causing our shoulder pain. So we're going to discuss some possible causes right now. 44 to 65% of reported shoulder pain is related to or caused by impingement syndrome. And impingement is just a fancy word that means squishing. Impingement syndrome involves compression or squishing of the rotator cuff or bursa. So it's kind of like we were showing in that picture before. When that space gets narrowed, those structures get pinched. And when they get pinched, they get injured. So as we discussed earlier, the space between the shoulder blade and the humerus houses the rotator cuff tendons and bursa. Again, if the space should narrow, as seen in this picture, you can see right here, this is an X-ray of a shoulder joint. And you can see where that arrow is pointing. It's really, that space has become really small. So you're going to get rubbing there. So we know that the structures get injured when the space narrows. So what narrows the space? What causes it to narrow? Well, one big factor that causes narrowing of that space is poor posture. Poor posture, I'm sorry to tell you, poor posture can result in narrowing of the space, which then causes stiffness and pain. So we're going to do a little experiment here. We're going to slouch down, kind of like round your shoulders and really slouch, okay? Or maybe just stay in the position that you perhaps were already sitting in. So from that position, we're going to raise your arm as high as you can. And as you can see, I can only raise my arm so high because in my slouch position, it's not allowing my shoulder to move very much. But if I sit nice and tall, I can raise my arm all the way up because now that space is open. Now I have much more range of motion and movement, and I just get much better range. So what keeps that space open, or what helps to keep that space open besides your posture? How can we control that? It's the rotator cuff muscles. They help maintain the joint space in this neutral open position. If the joint space is not maintained, the impingement can result in rotator cuff tendonitis, bursitis, and even rotator cuff tears. That's what we were talking about earlier. So that's a huge problem. Another cause of shoulder pain can be what is commonly called frozen shoulder, or the fancy medical term, adhesive capsulitis. This involves thickening of the capsule around the joint space. So as you can see in the picture, the joint above is a nice healthy capsule. And in our picture below with adhesive capsulitis, you see a lot of adhesions or scar tissue, inflammation, and then thickening of that joint capsule. The symptoms of frozen shoulder include sharp pain and restriction in movement in almost all ranges of motion, which includes reaching up, reaching out to the side, reaching behind your back, and so on. Unfortunately, there is no known direct cause of frozen shoulder, but it can be related to trauma, to metabolic disorders such as diabetes, or even immobility itself. Let's say you're on bed rest and you're just not able to move that shoulder. Maybe you just had another surgery for something else. Just having that shoulder immobilized can also result in a frozen shoulder. Alternatively, another cause of shoulder pain can be hypermobility or instability of the shoulder joint. So just as it's bad to have not enough movement, it is also bad to have too much movement. If there's too much movement of the shoulder joint, the structures can get strained. Dislocation can occur due to laxity of the capsule or even the result of trauma, such as falling on an outstretched arm. Also, weakness of the rotator cuff muscles can also result in instability of the shoulder. So if your muscles aren't strong enough to support that joint in a nice neutral position, that can also result in instability. So how do we handle or treat these disorders, and what does successful non-invasive treatment look like? Okay, there's a few components to successful treatment, and this is not all inclusive, but this is what we found to really work. The first is hands-on physical therapy. So that's called manual therapy. The therapist can mobilize the joint, which helps to stretch the capsule, manually stretch the joint, and mobilize or release the muscles and soft tissues to lengthen what has become tight or stiff. Modalities is another possible inclusion of successful treatment, and that includes application of heat, ice, electrical stimulation in order to improve blood flow, reduce inflammation, and aid in healing. And then finally, successful treatment is definitely going to include exercise. Exercise is really important for the health of our joints and muscles. Exercise can strengthen weak muscles or stretch tight areas in order to restore proper alignment and movement of the shoulder joint. So we're going to do a little bit of exercise right now. If you have a band with you, you can do it with us. If not, you can just kind of watch, hopefully someone come out and do the exercises with me. So I'm just going to get out of my screen here, and we're going to demo some exercises. In your email, you may have received a little exercise sheet. So these are the ones that we're going to do if you're interested, okay? Sorry, Erica, I think you're up. Okay. My lovely assistant, Erica, is going to help me out with some of these exercises. So the first one we're going to do is using your band. This is Erica, in case you don't know her. She's one of the physical therapists here in West LA, and she's fabulous. Thank you, my dear. Okay, so let me angle this for you. Okay. So Erica is going to take the band in front of her body. She's keeping her elbows in by her side. She's going to squeeze her shoulder blades together in the back and pull out onto the band.
Hey, Mari, can you move closer to the mic? We just can't hear you.
Oh, I'm sorry.
Yeah.
How about now?
Yeah. You
Is that
can
better? I'm sorry.
down off to the side closer. Thanks.
Sure. Okay, so Erica is going to take her band in front of her body with her elbows in by her side. She's going to squeeze her shoulder blades together and pull out on her band. Good. And then we'll just do about 10 repetitions of that. Nice and slow and controlled. And our goal here is to, again, open up that joint space in the front and start tightening up her scapular muscles in the back. So she's working on a little bit of strength and a little bit of joint position here with this exercise. Oh, sorry. Don't want to make her do too many. It's the end of the day, let's be fair. And this is called scapular retraction with external rotation. Okay, thank you, Erica. So then our next exercise, we're going to use our pole here. You can tie that around the pole, Erica. And at home, you could tie it in a door, tie it to a doorknob, just anything to fixate so that you've got two ends. And we're going to do a little rowing. Sorry, you're like, what are we doing? So she's going to stand in front of the band. She's going to take one band in each of her hands. So she's got it tied in a knot with two pieces. She's going to, again, kind of lead with her shoulder blades. So squeeze them together, opening up that joint space. And then she's going to pull back on the band, bringing her elbows in tight by her side. So she's opening her chest and she's strengthening those scapular muscles in her back. And we'll do about 10 reps of those as well. Okay. So squeeze the shoulder blades, draw back with the band. And if she's standing, she's always pulling in with her abdominals. She's always using her core. Even if she's sitting, she's also doing that. It's always important for posture and for stability that we engage the core whenever we're upright. All right, so that's 10 right there. Perfect. So now she's going to strengthen specifically just her rotator cuff muscles. So she's going to take one of the straps. She's just going to let the other one drop. And I have a towel here that she's going to roll, and she's just going to place it under her elbow. And she's going to use actually her outside arm because we're going to do her external rotation. Oh, that's right. Sorry. Okay. So she's got it under the elbow, and then in the outside hand is going to take the band. She's going to anchor her shoulder blade against her back. And then using her towel as a pivot point or fulcrum, she's going to rotate out with that arm, keeping a 90-degree angle at her elbow. So now she's specifically isolating her rotator cuff muscles. Wonderful. And then as she does that, she keeps that shoulder open and she keeps that joint space in as neutral position as she can get it. And she's going to do 10 on this side, and then she's going to do 10 on the other side. Perfect. I have a feeling people didn't get the 5 o'clock. Okay, so let me bring you over so that she can face you for the other side. There we go. A little bit. So now she's doing her other arm, so she's just turned around. Outside arm takes the strap. She's got her towel roll under her elbow. She's anchoring her shoulder blade against her back. And she's gently pulling out on the band, activating her rotator cuff.
And is her wrist always going to be facing up on that one?
Sometimes it can be up, it can be neutral, which is like holding them up, or it can be down.
Okay.
Yeah, it really doesn't. It doesn't matter. I think probably the most open position of the shoulder is going to be with the wrist, the palm up, like she had the first time. But not everyone has the mobility to do that. So whichever way you can do without causing too much discomfort. Okay, perfect. And that's 10 right there. Okay, awesome. So the last thing we have is a stretch, and we have it using the doorway, but since we don't have a doorway here, we are just going to bring her arms behind her back. So go ahead and let me show you Erica again. Yeah, she's just going, yeah, we're just gonna clasp your hands. Well, no, we'll take her hands behind the back and then turn to the side so they can see you. She's gonna clasp her hands together. She's going to straighten her elbows out and slightly move the back of her hands away from her bottom. And that way she's stretching in through her chest. So if you don't have access to a doorway, you can just do it this way. And then we're holding that at least 30 seconds because that's a stretch. And you always want to give the muscles time to lengthen. You don't want to shorten your stretch because that's just going to allow them to shorten and shrink back up. Okay, so stretches are hold. Exercises are repetitions. I don't know. I wasn't timing. Sorry, Erica. Great. Thank you. So those are just a few examples of exercises that you may do to rehab your shoulder. If you were to come in and be evaluated, it would be more specified to you, but that's just a couple of exercises that are commonly done for the shoulder. So I'm going to go back and share my screen here, kind of wrapping up. Let's got some dogs. Okay, so what are you going to do about your shoulder pain? I would ask that you please do not ignore it. At M3 Physical Therapy, as many of you know, we can help you handle your pain. We offer free screens for those of you who may want to learn a little bit more about how physical therapy can help you or what physical therapy is. But we also would love to book you for an evaluation so that you can start handling your shoulder pain today. Ignoring the pain should not be the #1 option. Waiting for the pain to go away can allow the situation to worsen and could possibly result in damage that may require more serious interventions, such as surgery. So you really don't want to wait that long, because if you can avoid surgery, I think that's everybody's goal. I've listed our contact information here on this slide. We've got our address, we've got our phone number, my email, and our website. And I'd like to answer any questions that you all might have at this time. Open it up to the floor.
Okay. Um, see, Mari, am I
Yes.
muted? Okay.
Got you.
Okay, thank you. Now, in order to do a full program with the shoulder, I would need a doctor's referral, right?
Yes, generally for specific insurances, they do require, I believe, like if you're on Medicare, they require a doctor's prescription. If you don't have one, you can always come in for the evaluation. We
Okay.
can do the evaluation and then send the plan of care to your doctor. The
Mhm.
doctor can sign that, and then you can continue with physical therapy. So that's always an option too, if you're having trouble, getting in to see your doctor to get a prescription.
Okay.
Yeah, I have a quick question. I've torn the left shoulder rotator cuff twice.
Oh,
And the second time I was told it can't be fixed by arthroscopic surgery. It would need
mhm.
more like a shoulder replacement, what they call a shoulder replacement.
Yeah.
But I was wondering, are there any exercises that you can suggest, maybe among
Yeah.
those that you've given us,
Yeah.
that
Yeah.
would help that?
Definitely. So it depends on how many. So there's 4 rotator cuff muscles, and chances are you didn't tear them all. So you definitely want to strengthen the ones that remain. And that is going to be kind of like I showed you tonight, where you are, squeezing the shoulder blades back. That's one thing. And then also kind of working the rotational movement, so internal and external rotation, to keep what you have left nice and strong. With tears, it doesn't always result in a total shoulder replacement. I do know a lot of people that have gone that path at some point, but you want to try to save whatever musculature you have for as long as you can. Yeah, because the total shoulder is a pretty serious surgery, and
Yes,
it's a rough one.
at least it
yeah.
looks like it. It looks like it, what I've seen. It takes about 3
recommend,
months to recover.
or maybe longer. It's a rough one. So I definitely recommend, the exercises that I showed you tonight. There's just a little sample, but there's plenty more that, you could work on to maximize your strength and your mobility so that you can avoid that surgery. Yeah. Anybody else?
Mari, for that contact information on there.
Yeah.
So that's the 310 number would be the best number to call. And then just, I can just say that I've been in this Zoom room and,
Yes,
and then
absolutely.
schedule the consultation, but out here in West Hills.
Oh, yeah. So this number actually is West LA. West Hills has another number.
Oh, okay. It's at the
I'm gonna get
bottom
it for you.
It's at the bottom of the handout.
Is it? Oh, good.
Yeah,
I'm sorry. I was like, I'm gonna get it for you, but I don't have it right now. But yes, this is
right
West LA.
there. Yeah. Okay.
Yeah. So yeah, use the West Hills number to reach them directly. But we both kind of communicate freely between the offices. So if you were, if you couldn't locate that number, we could easily transfer you or give it to you.
Okay, perfect.
Mari, I've just missed the beginning of that question, but the question was, what was the West Hills phone number?
Yes.
Okay,
but
so
she found it.
She
found
found
it on the handout.
Yeah, so the handout has both clinics information as well as the email that was sent out for both the confirmation and the recording of this will be including both in clinics.
Thank you, Amanda. All right. Any other questions? No? All right. Well, it's been really nice spending some time with you. I really do hope that you work on your shoulder and handle your pain and get it settled, because yeah, if we can avoid surgery, I think that's everybody's bottom line. So thank you for coming, everyone.
Thank you. Thank you very much,
Thank
Mari,
you.
for spending the time.
You're very welcome. My pleasure.